common respiratory virus that affects the lungs and breathing passages in both the young and the old, and the winter season is when it peaks. NBC 10's Trey Miner has more on what to look for to help prevent the spread of this virus.
RSV is a common respiratory virus, but for infants, older adults, and people with weakened immune systems, it can be far more serious. With the peak season for RSV in full effect, parents need to know what to look for.
Usually it starts out just like a cold, runny nose, cough. Sometimes in the, especially the younger kids, I'm talking about babies, they develop some respiratory problems, trouble breathing, coughing, and not eating well, not sleeping well because of the infection that's moved into their lungs.
RSV spreads easily in daycare, schools, and crowded indoor spaces. If you think your child has it, get them to a doctor to prevent spreading it.
Call their doctor. There are tests that can be run. It requires getting a sample of mucus from the nose, and then a test can be run in the office, a fairly quick test that tells you whether they have RSV or not.
Doctors stress everyday precautions such as washing hands and avoiding close contact with newborns or older relatives when symptoms appear.
The best way to prevent it is to avoid being around anyone with a cold, because you can't tell just by looking at them whether they have RSV or not. If a child is diagnosed with RSV, or an adult, then they need to quarantine themselves. They need to stay away from, especially babies in the 1 month or less age.
RSV can be unpredictable, so doctors are urging families to stay alert and take steps now to limit the spread. Reporting for your Arkansas News Source, I am Trey Miner.